Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, I'm going to talk about the signs and symptoms of depression. The signs and symptoms of depression. But first, let's define what depression is. Depression is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Now, some forms of depression are slightly different, and they may develop under unique circumstances, such as persistent depressive disorder. That's a depressed mood that lasts for at least 2 years. A person diagnosed with persistent depressive disorder may have episodes of major depression along with periods of less severe symptoms, but symptoms must last for 2 years and be considered persistent depressive disorder. Now you have perinatal depression. It's much more serious than the baby blues that many women experience after giving birth. Women with prenatal depression experience full-blown major depression during pregnancy or after delivery, which is known as postpartum depression. Feelings of extreme sadness, anxiety, and exhaustion that accompany perinatal depression make it difficult for these new mothers to complete daily care activities for themselves and for their new babies. Now you have psychotic depression that occurs when a person has severe depression plus having some form of psychosis, such as having disturbed false fixed beliefs, or we call them delusions. And you can connect that to a sociopathic component as well. That's right. When you have false beliefs and delusions, that's also part of schizophrenia. That is a component of schizophrenia because the delusions and false beliefs are common with that symptom. So, moving on. You can also experience false beliefs or hearing or seeing upsetting things that others cannot hear or see. Hallucinations, to be frank. The psychotic symptoms typically have a depressive theme, such as delusions of guilt, poverty, or illness. Now you have a seasonal affective disorder. It's characterized by the onset of depression during the winter months. When there is less natural sunlight, the depression generally lifts during spring and summer. Winter depression typically accompanied by social withdrawal, increased sleep, and weight gain. Predictably returns every year in seasonal affective order. That's right. It basically returns every year because it's seasonal. Now here's a big one. Bipolar disorder, which is very different from depression, but it's included in the list because sometimes someone with bipolar disorder experiences episodes of extremely low moods that meet criteria for major depression known as bipolar depression. But a person with a bipolar disorder also experiences extremely high euphoric and irritable moods called mania, or a less severe form called hypomania. Now, examples of other types of disorders newly added to the diagnostic classification of the DSM-5 include disruptive mood dysregulation disorder, that's diagnosed in children and adolescents, and you have the postmenstrual dysphoric disorder known as PMDD. Now, moving on. When you have depression, there are signs and symptoms that come along with it. Now, anybody has been experiencing the following signs and symptoms most of the day or nearly every day for at least 2 weeks, you may be suffering from depression. Now, here are the signs and symptoms. You're going to have persistent, sad, anxious, or empty moods, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthiness, or hopelessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless, or having trouble sitting still. You have difficulty concentrating, remembering, or even making decisions, difficulty sleeping, early morning awaking, or even oversleeping, appetite, or weight changes. You also have thoughts of suicide or suicidal attempts or even death, aches or pains, headaches, cramps, or digestive problems without a clear physical cause and or that do not ease even with treatment. Now, not everyone who is depressed experiences every symptom. Some people experience only a few symptoms while others may experience many. Several persistent symptoms in addition to low mood are required for a diagnosis of major depression. But people with only a few but distressing symptoms may benefit from treatment of their subsyndromal, that's right, subsyndromal depression. The severity and frequency of symptoms and how long they will last vary depending on the individual and his or her particular illness. Symptoms may also vary depending on the stage of illness. Now you have risk factors. Depression is one of the most common mental disorders in the United States. Current research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Depression can happen at any age, but often begins in adulthood. Depression is now recognized as occurring in children and adolescents, although it sometimes presents with more prominent irritability than low mood. Many chronic mood and anxiety disorders in adults begin as high levels of anxiety in children. Depression, especially in midlife or older adults, can concur with other serious medical illnesses such as diabetes, cancer, heart disease, and Parkinson's disease. These conditions are often worse when depression is present. Sometimes medications taken for these physical illnesses may cause side effects that even contribute to depression. A doctor experienced in treating these complicated illnesses can work with you with a plan for the best treatment strategy. Now, some of the risk factors include personal family history of depression, major life changes, trauma or stress, certain physical illnesses, and medications. Now, with everything, when it comes to medical, there are treatments. Now, depression, even the most severe cases, can be treated. The earlier the treatment can begin, the more effective it is. Depression is usually treated with medications, psychotherapy, or a combination of the two. If these treatments do not reduce symptoms, electroconvulsive therapy, known as ECT, and other brain stimulation therapies may be options to explore. Now, there are medications. Now, antidepressants are medicines that treat depression. They may help improve the way your brain uses certain chemicals that control moods or stress. You may need to try several different antidepressant medicines before finding one that improves your symptoms and has manageable side effects. Medication that has helped you or a close family member in the past will often be considered. Now, remember something now, antidepressants take time, basically 2 to 4 weeks to work, and often symptoms such as sleep, appetite, and concentration problems improve before mood lifts. So it is important to give medication a chance before reaching conclusions about its effectiveness. If you begin taking antidepressants, do not stop taking them without the help of a doctor. Sometimes people taking antidepressants feel better and then stop taking the medication on their own, and the depression returns. When you and your doctor have decided it's time to stop the medication, usually after a course of 6 to 12 months, the doctor will help you slowly and safely decrease your dose. Stopping them abruptly can cause withdrawal symptoms. Now, with this, you may have heard about the herbal medicine called St. John's wort. Although it is a top-selling botanical product, the FDA has not approved its use as an over-the-counter prescription for depression. And there are serious concerns about safety and its effectiveness. So do not use St. John's wort before talking to your doctor, your healthcare provider. Other natural products are basically sold as dietary supplements, including omega-3 fatty acids. Then you have SAM, and that is remaining under the study, but has not been proven safe or effective for routine use. So, for more information on herbal and complementary approaches and current research, please visit the Natural Center for Complementary and Integrative Health. Now, when you deal with psychotherapies, they basically help people with depression. Examples of evidence-based approaches specific to the treatment of depression include cognitive behavioral therapy, known as BCT or CBT, interpersonal therapy, that's IBT, and problem-solving therapy. You can also find that at the NIMH website. And there are also brain stimulation therapies. And ECT can provide relief for people who have severe depression, who have not been able to feel better with other treatments. Then you already have ECT. That could be an effective treatment for depression. And in some cases that are very severe, rapid response is necessary, or medications cannot be used safely. So ECT can be a first-time intervention. So beyond treatment, here's some things you can do. Try to be active and exercise. Set realistic goals for yourself. Try to spend time with other people and confide in a trusted friend or relative. Try not to isolate yourself and let others help you. Expect your mood to improve gradually, not immediately. So postpone important decisions such as getting married or divorced or changing jobs until you feel better. Now, you must discuss decisions with others who know you very well and have a more objective view of your situation. You must continue to educate yourself. Again, as I do a lot of these videos on mental health disorders, all of them have a connection to each other, and you basically heard some of the familiar mental health illnesses that were mentioned in my past videos, such as suicide, eating disorders, weight gain, heart disease, and cancer. What I want to tell you is these issues are real. Now, a lot of us don't know about depression unless you have seen people with depression. And some of us think a lot of these disorders are made up. They're not. You have a lot of people who suffer through depression every year. Some of these individuals could be your friends or your family members and even some of your teachers. But one thing that is clear to me, there are numerous cases. Just because we don't see what's going on, it's always best to educate ourselves with what's going on with mental illness. And some of us don't even know we have mental illnesses. We're perfectly normal. And that's true with all these illnesses. You don't know until you snap. This is why I keep educating my audience on how to take care of themselves when they have these mental disorders. Now, again, going over brain stimulation therapies. Well, when we talk about, again, ECT, may cause some side effects, including confusion and disorientation. Short-term side effects are usually occurring. You also can have memory loss. However, when you use ECT, and that is electroconvulsive therapy, well, is it safe? Well, it is safe. But again, we use it when regular medicines aren't working. But basically, when you have depression, you have to keep on getting it treated. You must understand that your life is not over either. A lot of people with mental illness go on to be successful. Now, she didn't have a mental illness, but if anybody remembers Helen Keller, she couldn't see or hear, but ended up being very famous. So I want everybody to understand with mental illness, you can have an active life. What's going to cut your life down is if you go in the wrong direction. And one thing you don't want to do while you have any type of mental illness is start smoking, because that's where the cancer occurs. Don't overeat, because your chances of gaining weight increase much greater. And also, you must remember something too if you're depressed. When you eat, you overeat, which can lead into diabetes. And I did diabetes last night, and when you have diabetes and depression, you're not in a great state. Because a number of these mental health disorders that I talk about, it's a combination of everything. And again, as I stress it out to you, a number of us are normal. That's why I told you in some of my videos, I didn't have any of these depressions, but I had my fair share of anger issues and got help as well. Because anger can lead to stress, which can lead into suicidal thoughts and depression. And of course, depression also includes being bipolar, which is bipolar depression, which also in depression, there are also false and delusional beliefs, which lead into a component of schizophrenia. You see how to connect the dots? You may have a multitude of mental disorders. You just don't know what they are. But one must understand, when they view my videos, one mental disorder could lead to 2, to 3, to 4. And I urge everybody, if you have any mental diseases like depression, get it checked out as soon as possible. It's like a car. If you see a problem with your car, take care of it as soon as possible. Because if you don't, it's going to get costly. Well, that's the same thing that happens with mental health illness. Checking the problem, educating yourself, and getting the proper help. And when you get the help, you must do what your health provider asks you to do. Again, going back to medication. You might feel good, but let your doctor or your healthcare professional do their job. Allow them to strategically remove you from the medicine. It's the same way that people get these weight loss surgeries. Well, they only help if you follow the program, because there have been people who've gotten weight loss surgeries and gained the weight right back. All they did was lose a lot of nutrition. And I'm going to do a video on that as well, because there are a lot of people doing that bariatric surgery. And altering your body doesn't necessarily help you either. But going back to depression, there are a number of us who have depression. Again, if you think you may have any types of depression, start making an appointment to see your doctor or your healthcare provider. This could be your primary care practitioner or healthcare provider who specializes in diagnosing and treating mental health conditions. If you get to your doctor right away, they can capture the symptoms right away. So please be smart. Don't wait too late. Because like I said in my other mental health videos, when you get help, you can save your life as well as others. And that's what we want to do, because we are all human. But we all must recognize that we're not invincible. We're all vulnerable. So put your pride down. When you have a problem, seek help, because it takes more pride to seek help than being silent. Because people who are proactive get seen. People who are passive get ignored. Remember those words for thought. And it's my commentary for this edition of the 401 Talk Zone radio show for this evening, Saturday, April 23rd, 2017. Tune into the 401 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. We had a fantastic show yesterday. We're going to have a fantastic show next week when we talk about the working and educated individuals, should they leave the African American community. The only way you're going to get involved with the topic, you must participate. The number to call in is 215-383-5785. And if you like my videos, please share and subscribe to the 401 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now on this channel, I don't debate, utilize emotion, or controversial issues, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive on this channel. If you listen to it, this is an education channel, and my job is to teach you. I'm very pragmatic, so I'm going to give you the tools so you can be educated. When you get out in the real world, you understand what's going on, and you will lower your risk of struggling, because the real world is very challenging. And if you don't have your tools, you're going to fail. And once you fail, without the tools, it's going to be very hard to succeed. And you're going to be utilizing trial and error, and you're going to build up your mistakes, and you'll lose confidence, and you will end up depressed. So, I urge everybody, listen to these videos closely. I researched the information, and I'm giving it to you free, because knowledge is power. And if you have a topic or a YouTube channel that you would like for me to discuss here on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave it in the comment section under the video. Make sure that your comments are pithy, no bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed evening. Good night.